We're a neuropsychiatric service based in Barnsley in South Yorkshire. We are a purpose-built facility, so everything was designed and planned right from the beginning to house patients that have had a traumatic brain injury. So we have facilities for wheelchairs and wider corridors, wider doorways for accessibility for everyone.
Typically, patients presents with acquired brain injury here, and we do admit patients with other neuropsychiatric problems such as cognitive problems after stroke, and sometimes people with degenerative neuropsychiatric disorders such as Alzheimer's, Lewy body dementia, and frontotemporal dementia. So we cater to the needs of a variety of patients with the neuropsychiatric problems.
The environment is purpose-built, so it's very functional, and we've got lots of facilities here, such as a purpose-built gym. We've got occupational rooms for doing lots of activities and music and different groups. We have an internet cafe, which is accessible to the patients. We have the ADL kitchen, which has been purpose-built with low units. So although everyone's not in a wheelchair, we've had to have different levels so that it's accessible for everyone, because we want people to regain the skills they need to live independently in the community, and cooking and budgeting is a big part of that. We take patients from all across the country because neuro is quite a specialised field. However, the current patients that we have are all quite local, from Leeds, Barnsley, Sheffield areas, and we're finding that they're enjoying being with us because they're closer to family, and family play a big part in rehabilitation for those patients.
Our MDT provide various interventions such as consultant psychiatrists providing optimization of medication, and specialist nurses they provide skilled nursing care and support, and also they offer weekly one-to-one sessions and also helps patients with their psychological and social issues. Our occupational therapist helps with the patient acquiring daily living skills. Our SLT helps patients with improving their communication, and our physio helps our patients to regain their muscle strength and balance. Our head of the care oversees the patient's care and provides required support and help.
The support that we provide at Cygnet Pindar House is specialist interventions such as gait re-education, balance work and coordination, also reducing their falls risk and also supporting them to go back to the community. If we identify some patients require some community skills assessments, then we go together, myself and the occupational therapist, to do that. Also, if they require any specialist like kitchen assessment or equipment assessment, then I support my colleagues. We just support each other, and that's what works best.
So the support that I provide to the service users at Pindar House, I assess speech, language and communication, and from there I would identify strengths and weaknesses in speech, language and communication, and work with service users using a person-centred approach to work towards regaining skills that are impaired. If skills can't be regained, then I would work with service users to use compensatory strategies just to increase their independence and function in daily living.
Our aim is to get the patients, as well as they can be, to move them forward and to move them out of Pindar House into an appropriate placement, whether that's to go back home with their family or whether that's to go into supported living or somewhere else that's more appropriate.
We had a patient who came to us when he was bedbound. He couldn't mobilize at all and he was high risk of falls. But whilst going through physiotherapy and occupational therapy and also nursing and psychology here, they developed further, and now he's mobilizing independently and he's looking at accessing the community now.